This is Dr. Cliff Grunseth coming to you with another weekly webinar from Spine West. Today we're going to follow up on our discussion regarding stem cells and PRP. There was a lot of questions about the kind of the indications, the mechanisms of this regenerative medicine business. We talked a little bit about the marketing that goes on inside of this regenerative medicine world. And we thought we'd shed a little light on some of the kind of the vocabulary soup and salad that you might get in this world. As you probably heard, there is platelet-rich plasma, bone marrow aspirate, mesenchymal stem cells, adipose stem cells, BMAC, MFAT, what else? Leukocyte-rich, platelet-rich plasma, leukocyte-poor, platelet-rich plasma, PRF, platelet-rich fibrin. So let's go through some of these terms just so that you have an understanding about where and when they apply, and how to use them, how to approach this field. So with that, the idea for the regenerative medicine is that with an acute injury, and these are all AI generated images, so excuse the accuracy, but the concept is when you hurt yourself, you develop an acute reaction, an acute phase response, which is an entire cascade of events that happens with an injury. The first thing that happens is typically you get some bleeding, and then you get some inflammation for the first few days, and then you start to get proliferation or growth of the area that's been injured, and then that over time will remodel itself. Sometimes the tendons or the tissue will just burn out. It just doesn't grow anymore. It's torn, it's degenerated, but it does not seem to heal itself fully. It can cause symptoms like pain, instability, etc. The whole idea for regenerative medicine is to kind of jumpstart the system, to use the body's natural healing properties to reactivate this whole cascade of healing and tissue repair, etc. What do we use it for? Well, you can use it for different tendon issues, soft tissue injuries. We can use it sometimes for osteoarthritis, like degeneration in the joint. It's not necessarily going to create a 20-year-old joint again, but it can perhaps repair some of the damage which is going on. The big thing that you want to do is avoid more injury than you have to. And that's where the leukocyte-rich, leukocyte-poor, platelet-rich plasma comes into play. You can also use it sometimes in the spine, sometimes for instability. But the idea is that these so-called regenerative medicine tissues, like stem cells that you hear so much about, or the platelets that you maybe hear about, are real. They are being used quite a bit. The marketing is well ahead of the science, but anecdotally, there are use cases for this type of material. One of the areas for harvesting the mesenchymal, the stem cells, is from bone marrow. Bone marrow has a lot of different growth factors in it. You've got platelets, you've got different cells, hematopoietic cells, the cells that make new blood products like red blood cells, white blood cells, etc. That comes from your bone marrow. But there's also these stem cells which actually can, in theory, create new tissue types. Again, it's the mesenchymal tissue type, which is the cartilage and the bone and things like that. You also can get the stem cells from fat. You can emulsify fat, and inside of that conglomerate or that little emulsified fluid fatty layer are stem cells which can grow. Those are called adipose stem cells, and sometimes you can use that as well for this regenerative process. the more classic or the more commonly used material are the platelets from the blood. We extract blood, centrifuge them out, usually with a high-tech centrifuge, and then we re-inject those back into the body, depending on where the injury is. Now, the thing about the centrifuge, or the separation of the material of the blood and bone marrow, is that a lot of times it is based on weight, and the weight of the cells will separate them out from the whole blood, so that you have this one area of kind of small cell type or small parts, which are the platelets. You can also, in that platelet layer, it's very close to the white cells, and depending on what type of equipment you use will determine how clean, quote unquote, the material is that you inject back in. At Spine West, we use a flow cytometer, so we actually use the refraction of the blood that's circulating through the machine to identify those cells that are larger and smaller, depending on how they refract light. So it's a much more specific, personalized. You can dial it in. It's not just a one size fits all. Let's centrifuge it out, throw it back in, spray and pray. Hope it works for you. So with that, you want to really be careful about what you're injecting. If you're injecting soft tissue, say you're injecting a tendon, what you want to do is usually activate some inflammation. You want it to be irritated for a bit, and you want those leukocytes, the white cells, in that mixture, not just the platelets, so that it really awakens the dragon of the body's natural healing response. So that is kind of the standard for soft tissue regenerative medicine treatment. Again, in that case, you do want some of the white cells, and centrifuging based on the weight of the cell and the size of the cell may be okay. It's much better to dial in, though, and be specific about how much concentration of the platelets, how much white cell layer do you have in there that will determine the outcome of the injection. Because this is not paid by insurance, it's expensive, and you really want to make sure you're doing the right thing. It's not the same as, one size fits all. Just like if you buy a seat on an airplane, you can go standby, you can have an economy seat where you don't necessarily get to reserve your seat. You can get business class, you can get first class. So depending on what you're trying to achieve for the regenerative medicine will determine oftentimes what the outcome will be. And there are ways to maximize your outcome with the different types of material. Now, when you talk about bone marrow aspirate, that does have some stem cells in it, but realize that it's not pure stem cells. It's about 0.001% of stem cells that are actually injected in. And the key thing is if the clinic doesn't really understand what the stem cells do and how they act, injecting them has to be done well. It's not just harvesting the material, but you have to do it very slowly, not break the cells. Otherwise, you're just injecting a bunch of cellular debris, which does nothing for actually using or harnessing the power of the stem cells in the injectate. The platelets are a little bit more forgiving because those will release. They're like little packets of growth factors that will release in an area, and then they attract other cells into the place where it's injected and initiate that healing response. Like I said, there's a whole cascade of call-outs that the body does when you have those growth factors in an area It allows permeability of the blood vessels so that they can escape out of the blood and get to the targeted area. So there are cells that clean up the area. There are cells that repair, lay down new collagen, and then there are cells that remodel the whole process. All chemically based, which sits inside of these cytokines. Some of these chemicals will inflame, and some of those will inhibit the inflammation. And that's the key thing. So the idea is that if you're going to inject into a joint, you do not want to flare up the joint. You do not want more inflammation inside the joint. You really want to put in these growth factors without causing an inflammatory response. Otherwise, you can, in theory, degrade the cartilage that's already there, unlike the soft tissues like tendons and ligaments, which would benefit from an inflammatory response. So you can get new collagen laid down. So those are the main concepts of it all. And there's a lot of different types of terms. Like I said, there's BMAC and MFAT and PRF, leukocyte rich, leukocyte poor, etc. And if you have questions about it, it's best to ask somebody that really knows what they're talking about and the science thereof. Spine West, we've been doing it for over 15 years. We really follow the science and understand the mechanisms and try to personalize it for you. It's not a one-size-fits-all. It's really customized for what your indication for the procedure or for this material is. If you're going to, spend your own dollars to get this material injected back into you, you want to maximize the response. Some of the things, for example, is you need to stop alcohol. You need to stop smoking because that will inhibit platelets. You can enhance platelet recruitment or harvesting by activating the spleen. The spleen has a lot of platelets in it, and the way you can squeeze the platelets out of your system to a higher concentration before you harvest them is to actually do a little bit of exercise. It doesn't have to be some marathon. It really can just be walking up and down the stairs a few times just to get the body a little bit activated, and that will push more platelets into the system so that you can then harvest those and get a higher concentration of the growth factors to inject in. The recovery phase, as we talked about, is a stepwise approach. You want to receive the injection and then take it a little easy for a week. Then you slowly start to get back into activity for 1 to 3 weeks where you're not going full out. You really just try to keep things moving, and you don't want to damage the tissue by overdoing it. But then you can really start to stress it and try to rebuild the collagen and rebuild the strength of the tissue that you're trying to repair. So the exercise and stretching is always warranted after the initial inflammation phase has calmed down. That the inflammation phase is usually the first week, and then you can start your rehab program in a very progressive way. And then eventually you'll get out and back to where you want to be. Hopefully it may take up to 3 months before you really are at a level where it's plateaued, where the improvement is probably as good as it's going to get. You can repeat the procedure if you need to, just to see if you can get any more strength out of the tissue, decrease pain, etc. The big thing, again, is just be careful of the marketing and the claims that are out there. There's a lot of false claims. The FDA really is not on top of this at all. There are some places that have been shut down because of false advertising, etc. The big thing I can't emphasize enough is just having trust in the facility that you go to, and that's worth your dollars. It's not a one-size-fits-all. It really needs to be personalized for you, what your condition is, what's the appropriate material that you should receive for your condition, with the best chance of a positive outcome. I hope that's helpful for you. If you have any questions, give us a call or come on in. We can talk about it more. Hope you have a great day. We'll see you next time. Take care.